motion test here that was produced by Kara Shiflett here, and I talked to her at the convention, and she says you can get these on Amazon nowadays. So here's the code that's on the bottom. I guess you can just order it through Amazon. So it's ISBN 0-9653425-2-2. So I guess that's the, and this is the range of motion tests, part 1, upper body tests, and part 2, lower body tests. And probably they're about $60 or plus shipping, things like that. I have some here at the clinic if someone wanted to come to the clinic at 845 North Michigan Avenue, Suite 976W. Okay, so we're going to take a look at the peroneals here. But what are they called? They're called the weak ankle muscles. Okay, so that's the weak ankle or sprained ankle muscle, and it can compress here the peroneal nerve that can cause drop foot. Okay, but I wanted Justin to take the camera here for a second. But right. What's happening tonight? Cubs are gonna win!
Yeah! Oh,
That's it.
And you want to show this shirt too?
Okay, yeah. Cubs win! Cubs win!
Win the whole World Series! Yay!
All right, yeah.
Then I'll be able to drive again past my house.
Oh.
Okay, so let's take a look at the peroneus muscles. Okay, and we're gonna go ahead and have you come over here and lay on your side.
Okay.
And we're going to take a look at them. Look at the one or the other, so it doesn't matter.
Such an important muscle group, and one of the ones that...
All the way up in this little crevice. Keep coming up. More. Keep coming up. There we go. And so we're going to put a little pillow under your neck here. There, little neck roll. Okay, so this is a nice and comfortable way to take a look at it.
Did you want the strength test for the peroneal, or...?
Yes.
Would you do that?
Do you have, is it a bad position?
Well, if she just turns the lie on her back, it'd be fine.
Okay, great.
If you just turn the lie on your back real quick, we'll do a strength test for the peroneal.
Okay.
But you have the inversion test to show too, right?
We did that already, but let's do it again.
We did it?
Yeah, well, I'll do it again. Let's do it. Okay, you're going to have me do it first.
Yeah.
Okay. So here we want to be able to invert the foot, and then you want to feel if it can evert as well, because it doesn't want to evert at all. You can feel the peroneals don't want to evert at all. They don't. They're stuck.
So
they
grab and pull it.
Wow.
Eversion.
They won't. No, they're supposed to do that, but they won't.
But they're not doing it.
They won't do it. Yeah.
They're not doing it.
They won't do it.
Okay.
Let's go ahead and we're going to invert here.
So that's inversion, which
and
is
then here,
stretching the peroneal.
And here on this one, it works a little bit better, but it doesn't want to.
It doesn't want to contract.
Doesn't want to contract. Okay.
Okay.
So that's good.
Not surprising. The tests are the same exact way. There are 2 tests for the peroneal. One is for the longus and brevis together, and one is for the tertius. So we take the toes, point them down, because that stretches the peroneus, and then turn out. And that will give us a straight line for the peroneus, longus, and brevis. Keep that foot in that position. Now, the ankle muscles are not the easiest to test, but what you want to do is you want to get a good support on the inside of the ankle, point the toe down and out, and you're just going to twist this way. I'm going to twist just this way. Don't let me move. So you hold it there. That's her contraction. That's her conscious contraction, is keeping the foot in that position. And then I'm going to push, hold out, push, 1, 2, and it's folding it 2 easily. Down, point toes down and out, 1, 2, there's nothing there. Okay? It should be rock solid. When she locks the ankle in that, I should be able to hang on the ankle and it should be solid. I mean, these are very strong muscles. When you get the ankle to lock, remember, when you're running, that's all of your body weight plus all the, the momentum of your entire body. Let's say you were running as fast as you could and had to cut this direction. I mean, that peroneal I would have to handle my 200 pounds plus about 4 times that with the inertia of my change in direction. You'd have to handle probably 800 pounds. So for her to point her toes down and out, and for me, doesn't even want to stay there, point, keep them down and out, and for me to just be able to fold them 1, 2, just like that, that's really, really weak. She can roll and sprain this ankle very easily. Okay. For peroneus tertius,
thank you.
Yeah, it's the short guy. That's the peroneus tertius. When you're feeling down the side, you get the little divot. That's where the peroneus tertius starts, and it just goes right to here. Okay, longest wraps all the way around to here. Goes all the way around, comes underneath and wraps to here.
And peroneus tertius comes in front, and it goes right here to the 5th metatarsal.
Exactly, peroneus tertius exactly comes right in front. Boop, and brevis comes behind the ankle, but there.
It attaches almost.
Okay, so for peroneus tertius, it's up and out like this. So she keeps this up and out, and again, I'm going to fold down and in like this. So keep it up and out, push, push. Oh yeah, see, in this one, you see,
Oh, that one's stronger.
see, I'm pulling her whole body, and the whole body is sliding on the table. These are really strong muscles.
Yeah, yes.
They're like pit bull. Once they clamp, that's it. But so that one again, up and out, push, push. So I can pull her whole body on the table. See?
The tertius is happy.
And the other one should be like that too. But I point down and out, point down and out, and push, push, push. I mean, nothing. You see?
One finger.
One finger.
Okay,
That's dramatic difference. So same thing. Point the toes down, turn all the way out, keep them out. I'm going to push in. I can feel already. It's just mush. It doesn't want to do anything. Okay?
Okay, and then the
And then
tertius
tertius up and out. Push.
And resist
Yep.
down.
And then, yeah,
And
so
strong.
that's totally strong. So,
Okay, so
is
why do
that
you think that the outside got so tight?
50 years of Morton's foot.
That's how it happened.
I would have to say that's
Untreated.
probably a good guess.
Untreated Morton's foot.
It-
50 years.
Skating.
Yes.
There
Yeah,
you go.
50 years of skating.
50 years of skating every time you're walking.
Yeah.
That's
Okay,
it.
so we're going to take a look at the peroneus.
Bravo. From the mouth of patience. We'll write a book. Our next book should be From the Mouth of Patience.
Okay, so turn sideways
Very
again.
nice. Very nice.
Put your head up here. And come in. Okay, great. Okay, so we're going to take a look at it. I'm going to put it a little bit forward so I can get a little platform
Sharon's
there for it.
famous side lying position.
I love it.
Fantastic.
And I'm going to find the head of the fibula so you can feel it right there.
If you're ever demoing in a class, it's a great position, right? You
Yes,
use
it
this every
is.
time for
This is-
demoing.
This is it. So I feel the head, and I'm going to go ahead and attach this right there all on the head. And we're going to go ahead and let's use our elbow right there, so we'll feel the attachment. And let's see, we'll take a look at you and see if you're too painful. So it feels a little tight, but it doesn't feel too painful there. Yeah. So then we're going to come down, we're going to feel, oh, we got a few taut bands there. And we got a couple taut bands here. So
We're definitely going to
you can
find
see
something. I know
we
that.
got some taut bands here, so we definitely have some taut bands here in the peroneus longus. So I'm going to go ahead, use my fingers to hold the peroneus. So I'm going to use this part of my elbow, use the fingers to hold the elbow in place.
Ooh, cool.
So what do you think?
It's very painful.
That's
it.
painful. Okay.
Yeah, so we're going to hold it there, breathe and relax. And we're going to come up slowly. And we're going to find that taut band. And we're going to go ahead and press right onto it. And we're going to come a little bit inferior and feel that taut band. And we're going to press right onto it.
How are we doing there? Nothing lightening yet, but
And come down a little forward. Now we're starting to get the peroneus brevis, as well as the longus. And we're going to come down a little bit more inferior, and we're going to go behind the malleolus, the ankle bone. So we call it an ankle bone or a malleolus. What do you
I
think?
like the ankle bone myself.
Either way.
What do you say? Either way,
Malleolus.
you go with malleolus.
Alright.
Stephanie, what do you say?
All right, I'm being outvoted here. All right, so up here, remember, this is where it inserts under that fibular head. That's where that nerve entrapment could take place, right here, right?
Right. And then, of course, that causes drop foot.
Yeah, drop foot. It pinches the nerve and just.
That goes to the anterior tibialis.
Yeah.
Now, anterior tibialis causes great toe pain and drop foot.
What causes the dropped calls on my cell phone? That's not the
That
same
calls on
thing.
the cell phone is not the same thing.
No, it's not the same.
Okay, not the same.
No, it's not the same thing.
So here we're coming all the way around the back of the malleolus. Then we're going to make a beeline and go right on the tendon, coming all the way.
Ooh, ow,
Right here, we
in
notice a
there,
little
you
tendon.
see.
Come this way, And that way, right
Can
there.
anyone postulate what might be right there that could shut the entire peroneus muscle off? Could be Golgi tendon organ, couldn't it?
Mm-hmm. So sometimes it's nice to go ahead and treat the whole tendon.
Heck yeah,
Mm-hmm.
absolutely.
And here we come down here towards attaching on the 5th.
Any area of the body that is screaming in pain when there's no need for it is causing a problem.
Mm-hmm.
So it may feel very bony, but there's actually really
So
good
it's
reason to
behind?
treat that area.
The ankle bone, and then over to here. And right here I find some taut band right there.
Yeah, exactly. And if you work on it, it will actually, I mean, don't you find that eventually it lets up and
Yes,
it's not
it does.
painful to touch anymore?
It is, it's not, yeah.
The closest thing to this work that's out there in the field besides sugar point therapy is called transverse friction massage. They just go to areas like that and they just rub on it back and forth until it becomes, you know, kind of anesthetic.
What did you say?
It's called transverse friction
No,
massage.
what did you say before?
The closest thing
I would
to...
not say that.
You wouldn't do that? Delete that?
No, I want you to delete that completely from
Okay.
everyone's thoughts.
Well, don't learn that anyway. You don't need to learn that. You just learn this.
Okay, so then we're going to come over here to across the bottom. So here we are. Here's our little tendon here, and then come over here, and then across all the way to the first metatarsal.
Ouch.
Ouch, he says. Okay.
Okay, let's see. Let's go ahead and let's look at a little bit of the range of motion, and let's see what. So we treated it a little bit with compression. Now I want to look with range of motion here, and I can see we have a little bit of dysfunction right here at the brevis. How's that feel, the brevis?
It's a little sore,
A little bit sore. Okay.
but not excruciating,
Mm-hmm.
which is good.
Good. So I'm going to shorten it a little bit, then lengthen it, and see what it's doing at all these different levels.
So she's taking it through its range of motion while she's feeling each part of the muscle
Mhm.
to see how each part of the muscle is reacting and contributing to the motion. Oh, we may have found a spot. Okay, she noticed that one. So maybe sometimes the thumb can find what the elbow can't, maybe? Depends.
Oh, well, you could do a lot of things with the elbow that you can do with the thumb.
Yeah.
Okay, so the tertius we don't need to do as much with, but there it is. Because we already tested it.
Well,
It wasn't too bad
The
there.
strength test was pretty good.
That was nice. But I'm looking around, see how it is over here. And it feels pretty good. And take it over the way to its attachment there. So let's go ahead and feel it again. So good range of motion of that. Okay, I'm just going to test it again here.
If you have any athlete and you want to feel confident that they're not going to hurt themselves on the field, you have to make sure their peronei work well. You know, because with the kind of peronei test we just did here, any kind of a sharp cut in basketball, football, you know, running the bases, anything like that.
Or how about someone who has a chronic sprained ankles?
Totally.
Yeah.
Yeah.
So that would be an important.
Yeah. And an
Okay.
older person who needs balance and coordination, you know, not to fall. These are really important things.
Exactly. And that's what the pebble mat was good for.
Oh yeah, probably it's good for things. Yeah.
Okay, so we did pretty good with this, but I can still feel that we have a little bit of taut bands. If you want to hit taut bands,
well, let's
here.
get it because it was really weak.
Let's do a little bit more with our elbow here. So what do you think of that spot?
That hurts really bad.
That hurts really bad. Okay. So you're using the opposite elbow from what you did before?
Often I might do that.
Yeah.
I try to be
Ambidextrous.
elbowed.
Ambi-elbowed.
Yes,
What's
elbow.
the elbow called? It's called...
The electronon?
yeah, olecranon.
Or it could be the oleocranon.
Yeah, oleocranon. So you would be ambi-oleocranon. Cranus. Ambi-oleocranus. She tries to be ambulocranus as often as possible,
Uh-huh.
meaning she uses both elbows.
Okay, remember I broke my elbow once.
Oh.
And see, that's really bad for myofascial trigger point therapist. Yeah?
Well, you shouldn't push that hard, Sharon. How hard can a trigger point be? Jeez.
Yeah. They said it would never straighten. That's
Yeah, that's
and of
right.
course it's straightened.
Yeah, well, it looks pretty straight these days.
Yeah, it's doing really well. It was a couple of years ago.
Yeah, it was a couple of years.
Uh-huh. Okay, let's take a look at your other proneus.
All right, the other peroneus. In terms of neurological relationships,
I use this thing, whatever you
Oh,
call
yeah,
it,
so- yeah.
all the time on that muscle.
Oh,
All
you're
the time.
always using it. Yeah.
And it just doesn't fix it.
It's not fixing
it doesn't stay
No.
fixed, huh?
It doesn't stay fixed. No.
Okay, all right.
Okay, let's come on up. I mean, with your neck right
All
there.
right, good.
So
So,
she likes to use. She was saying that she likes to use the
tiger tail, but it's just not staying fixed.
It won't stay fixed. No.
Okay, good observation. Very good observation.
Okay, so we're going to take a look at our proneus again on this side. So again, we're going to find the head of the fibula comes below it here where the muscles attach. So we're going to take a look at the attachment right there. And then we're going to come down and come all the way down and around the ankle. Take your little socks off and come around all the way here to the 5th metatarsal. And then we're going to come across here to the 1st.
Yeah, right there, exactly. Okay.
Okay, so we're going to take a look here. So we're going to look with our elbow, and we can see there's some taut bands.
Now, when Sharon's using her elbow, is it more or less
That's a lot of
pressure
taut bands.
than you're pushing with your self at home with your own tools?
I push pretty hard.
You do push pretty hard.
I really do,
All
but I can't dig in there.
Uh-huh.
Like it kind of just goes over the surface.
Yes.
You know what I mean?
Yes, yes.
Uh-huh.
Yeah.
Sometimes.
Are you pausing on the tender spots and really pushing in, or are you mostly just rolling over it?
Mostly rolling.
Okay. Well, I think Sharon's a big proponent of staying on a tender spot for a couple of breaths because that's what causes what they call that ischemic response or whatever it might be, but it causes that area to, it's for one moment it's completely squishing all the chemicals out, and then when you let it go, new blood supply flows in.
Mm-hmm.
So that I know that rolling over feels good, almost feels better sometimes, but it's actually not quite as effective
It's
as
good to go down to the bone.
down to the bone and hold it there. Yeah.
Okay, here you see that we have a few. So
Divots.
now this is myofascial pitting.
Yes.
She doesn't have any swelling,
No.
but the tissue is staying compressed.
Yeah,
and
it's
when
not edema.
It's just myofascial pitting, but
Yeah.
not due to swelling, not due to edema.
So what is it due to?
It's due to the muscle just sitting there. So you press on it, and it just stays. It's like this, and then you press on it, and it goes like that, but it just stays there
So it's
because
almost like
it doesn't have any blood supply. Probably doesn't have any ATP.
yeah.
Doesn't have any tumor necrosis. It's too much tumor necrosis alpha, substance P.
It's just like inhibited, and she
And yeah,
it's just. We tested it and it was like almost dead. I just like it wouldn't fire at all, and then when you push
this
on it,
is-
it doesn't even go back to
Yeah.
shape.
So here we're working. So we're doing the peroneus. We're getting it's down the center, anterior and posterior. So we're getting all different parts of it.
Muscle coma, nice, Leslie. That's exactly. And then I'm not promising anything, but there is a very common phenomenon where problems in the peronei causes those abductors to not fire like we found earlier. So remember when we tested her gluteus minimus, the range of motion test was okay, but the strength test was terrible. And we were kind of surprised by that because it didn't seem like it should be.
But
Well,
when we came down here to look at the peroneals,
yeah.
we can see that, and it could be. Remember, Dr. Fisher said, who did a lot of the research for Dr. Chabelle and Simon, said that if you have compressed tissue here in the peroneals, it could go up, and it could actually activate L5 and S1.
Yeah.
So and so definitely you could have referral up into the spinal root, and all the spinal root could come referred down.
Yep.
So we could do both ways.
Totally.
Yeah.
Absolutely.
So I'm just going to take a look at it in range of motion too.
Someone asked how you tell the difference between edema and the pitting.
Well, you can feel the tissue is real hard. You can feel there's no swelling. You can feel there's no swelling in the tissue here.
Edema would
Yeah.
be, you'd feel the swelling and
Yeah.
be, you know, like
You feel
filled
like
with water.
squishy.
You'd feel
You
it.
feel like it doesn't feel like filled with water.
Right.
It feels like it's hard.
Almost like memory
and
foam. Almost like a.
It feels like there's no water.
Yeah.
It feels
exactly.
like there's no water in it. Yeah. It doesn't feel, it doesn't feel squishy like water. It feels like no water.
Exactly.
Yeah. So this side we have a few of those pittings, and usually after I do that, then I'd like to erase it and get the pitting out. Yeah. So I'm taking a look at the tertius here. Let's go ahead and let's look at the tertius. Let's
You're
go
welcome.
ahead.
Great
And
question.
Mm-hmm. Tertius feels pretty good to you.
Mhm.
So in front of the ankle and over to the fifth.
Yeah, so you guys are, the way Sharon's teaching you, you're covering the entire cause and effect system. Like, let's say she had a first metatarsal deficit over a long time that caused problems with the peroneal, which caused irritation of the L5 nerve. That caused inhibition of some of the glute muscles, and then that caused low back instability that caused her to, bend over and pick up a pencil one day and throw her back out. The cause and effect is all being taken care of when you cover everything that's on that sheet, the master chart. You're looking at the nerve root. You're looking at every muscle that relates to that pain area. And when you get someone to pass all the range of motion tests, you are likely avoiding all those kinds of cause and effect problems, wherever they start and wherever they end, and if you address the underlying perpetuating factors especially. And that's the key.
So I'm getting right onto some taut bands right here again. So sometimes during a treatment I might treat this area 3 times.
Of course.
Mm-hmm.
Yeah. And after this we only have one more muscle, so we're going to have some time to go a little bit into the review the Morton's foot with you guys, just so you remember how to do
I
that.
hope we'll have plenty of time for that.
Yeah.
Okay, so a lot of times I also might use my ultrasound machine, and that often I'll use that right on the muscle that's causing the ankle pain.
Great.
So I'm just going to throw that on for a second. Use a little bit of gel.
Any kind of setting in particular?
Well, I like to use the high setting, but a lot of times for some people, when I first start working with them, I might use the low setting just to see how they react to it.
Okay.
And if they react okay, then I might go ahead and turn this right here. I get it on 12, which is the highest.
So 12 is the highest.
And this particular machine.
And she just turns it on. That's a timer over there.
22 minutes is on, but
This is a
I'll just use it
Sonicare
often. I
705.
just use it for about a minute.
Yeah, she's just getting in there to activate the tissue again. What does the ultrasound do? It sends deep heat in there.
Yeah, heat, and it's going to bring a little bit of blood supply.
Brings blood supply. Can break up some adhesions.
Makes it softer.
Yep.
And it would help to get rid of the fingerprints.
Yeah. If you're getting rid of the pitting. So it just breaks up the adhesions of the tissue.
After you have that pitting of the myofascial pitting, you want to erase it.
Yeah.
Okay. We're going to erase it now. So, but it wouldn't take too long. Sometimes just treating it for a few weeks, you might see it go away. Okay, so let's go ahead and take a look at it again. So usually I might just do a minute like that.
Just a minute. This is an old device, but one of the best ones, and you can still pick them up on eBay really inexpensively. Mettler Sonicare, if you'd like, the 705. Sharon replaces anything she gets with those because she keeps wanting those are.
Yeah, they sell. You can get they're about $2,100 or $200, but you can get them on eBay used.
$200 to $400.
$200 to $400, yeah, somewhere in there. Yeah. So they're very nice, and if you like, you can come in for training, and I could train you how to use the ultrasound in the myofascial protocol.
Yeah.
So I could give you a little training on how to use it safely.
Yeah, maybe we'll do a webinar.
And I'll give
on
a
that.
little seminar on that for you.
Yeah, maybe we'll do that.
Okay, so here we got our peroneals, and let's see how we're doing. So let's go invert, evert. So I still feel some trouble with the inverting and everting here. So it looks like it's going to need a little bit more time.
Yeah.
So I can feel
It's been like that a very long time.
very long time. Yeah. So I'll just take a look at the measurement of it here. Let's have you go lay on your back again. Okay, so we'll just measure it here. So that's giving us a pretty good range of motion right now.
Yeah, definitely.
That's good. But I could still feel some dysfunction in there when I was moving it. Yeah.
And how about the E version?
Okay, let's look at the E version. Okay, it's not everting
like to
quite as
evert
well.
much.
Yeah, doesn't like that as much. Okay, so let's do a little bit more work on the low back, and then we'll check it again. Okay.
Well, should I do
Oh,
strength
okay.
test to see?
Let's
Is
do
it
that.
okay?
Yeah, let's do that.
See if we had a change in the strength test.
Let's see if we improve
So,
our strength. Yeah.
Remember, for peroneus tertius, it's up and out, and that was fine. But now, for peroneus longus and brevis, it's toes down and out. Yep. Ooh, she's able to move it. She moved it on her own. Before I had to put it there, and she kind of held it, but barely. This time, she actually moved it.
Yes, you
so
did.
Now, so you're down and out. Don't let me push back and in. Hold. 1, 2, 3. Good. And I let go at the end just to show you that it had
Boing!
that
That was a boing!
Yeah.
So we improved the strength. So if we improve the strength, that would help you with your balance. That would be
Yeah,
great.
definitely.
And pain.
Awesome.
And pain.
Yes.
So point the toes down and out. You do that. Oops, see, she did it on her own.
Oh, yes, she did.
Okay, then push out into my hand, and I'm going to add resistance. 1, 2, 3. And she got it. Now, I
Okay.
wouldn't normally doing it like that. It's kind of weird for the patient, but I was doing it for demonstration purposes.
Great. That's good.
Normally, I would let up slowly.
So yeah, a little slowly. Yeah.
You can feel
Okay.
the difference, though, right?
Yeah, right.
And when you rotate your ankles, just see if you can feel like there's more strength now, or you can move them easier now.
They're a little bit more flexible.
Yeah.
Yeah.
They look more
So they
alive.
improved their range of motion
Yeah.
and strength. So
Yes.
that if you can improve range of motion and strength, then you know that we definitely improved it. Now you go ahead, let's stand up on it and then see how it looks.
Okay.
Okay.
Well,
And I.
standing up without orthotics, though, is that?
Oh, that's bad. That's bad.
Wow.
That's bad. Okay, let's
shoes.
get your shoes. So show us your shoe inserts that you have.
So these are the miracle shoe inserts. So
Yep.
they're 3.5.
3.5. That's
And
Just a
the
little
I
bit
just
of lift underneath the great
really
toe.
can't go anywhere without them. I
Yeah.
shouldn't walk in the house in bare feet or socks or. I mean, I really
gonna have to get
need
you
them
some sexy
all the
slips.
time. Yeah. And then
put
the
it-
heel lift, yeah.
yeah, put it on top here. So that's good.
Because one hip's a little smaller than the other two.
And just a tip for advanced body workers: if you still had trouble, you might go all the way into
Okay, so
the
we're gonna
toes.
we're gonna do this. Okay, this is our stretch, and that's our contraction, and our stretch, and our contraction, and our stretch, and our contraction. Good. On the other side, our stretch and contraction, and stretch and contraction, stretch. Good. Super.
Awesome.
Oh, super. So we got a little stronger.
Yes, I
That
think
was
so.
good.
Yeah.
But you know, one thing we didn't test. What if we test her gluteus minimus?
Well, we treated now the peroneal. What if
Yeah.
we go back and test the strength of gluteus minimus, which was almost inexplicably weak? So how
Yeah.
about you lie face up on the table again? Let's just
But you can have
see.
your shoes on. That's fine.
Okay.
Yeah, you can have your shoes
Okay.
on. Oh yeah,
All
it's
right.
fine. I mean, if the shoes were really uncomfortable, painful, I would say take them off, but they're not. Right?
They're
So,
so comfy.
they're comfy.
Yeah.
They're fine. As long as they're comfy. All right, so we had this inexplicable weakness. I went up into the abductors. I had the TFL, which was up 30 degrees, push up and out. And I added 1, 2, 3. Oh my gosh, it's strong now.
Okay.
And we had glute medius, which
Okay.
is directly lateral. Push out. 1, 2, 3, and strong.
And
then we
then
had
we take it
minimus.
down for the minimus.
Turn the leg out, push down and out toward the floor, and up. 1, 2, 3, and all of them
So
magically turned
our
on.
hypothesis was what
Was
was it?
correct.
It was our hypothesis was that possibly the peroneuses were actually referring dysfunction into the spinal roots and maybe causing weakness.
Yeah.
But when we fixed it, then at least about 30% it got strong,
Oh, yeah.
and all of the muscles got strong. So that's great.
We'll test the other side
That's
real
amazing.
quick.
Okay, great.
Up and out on the other side, push up and out, and I'll add 1, 2, 3. Yep, and
Strong.
push straight out. 1, right, straight out, and then 1, 2, 3. I mean, you can even just see she's just boom,
Boom, you're
into the
booming.
position. Push down and out, and then 1, 2, 3. Absolutely.
Okay.
Okay,
so-
one trick. When we get to the feet, what if we fix that and this, and it still had problems? you could work on the foot. The lateral foot muscles might be triggering this, which is triggering that.
Okay.
So you might work through the 5th and 4th metatarsal, the inner ossei in there of the feet.
Okay.
But we'll get to that eventually.
Okay, let's have you roll to the side and go ahead and sit up.
Yep.
Right. Yeah. Okay. Yes. Okay, wonderful. And then stand up. Wonderful. Okay, and how's that feeling?
Good.
Wonderful.
Yeah.
Super. So now what you need to do is learn how to treat your peroneal.
Yeah, I thought I was with the rolly thing, but I wasn't doing anything. I was just rolling over it.
It wasn't. So next you're going to learn how to do it. This is probably your
This
sock.
is one of them, yes.
Where's the other one?
Somewhere in the sheets. I don't know.
Okay, so we're going to take a look at Stephanie, maybe your vastus lateralis. Or who's vastus lateralis?
Mine was bad.
Okay, take a look at yours.
Okay.
All right, so take a look at your vastus lateralis. Okay, so we're going to do a little range of motion test for that.
So guys, we're going to probably finish up with this muscle. To review the Morton's foot, just look at our lower body perpetuating factors class. There's a whole class on it. There was an upper body's perpetuating factor, lower body perpetuating factor, and then it was foot perpetuating factor. Just look at that on our YouTube channel. You'll see everything about Morton's foot. The entire class was about Morton's foot.
Okay, so we're going to take a look at the heel to the seat test. So here, and then we're going to bring it also a little bit this way. So here's our heel to our seat test here, and we're going to go ahead and measure that to the ischial tuberosity to the heel, and that's 7.5 inches. Let's do the other leg.
Yep, our YouTube channel is National Self-Care Alliance. Search for that on YouTube. You'll find our channel and look for the class that says
7 inches here.
Yeah, Morton's foot, perpetuating factors.
So we're gonna take a look at your vastus lateralis. So we're gonna take a look at a little bit of it here on the lateral section here.
It was tighter on this leg last time.
Yes, it was last time. Yeah.
That.
Should we take a quick picture?
Can we look at the vastus lateralis?
Behind
Great.
you.
Oh, super. So super duper. Here it is. So here's the vastus lateralis, and you can see it attaches right here on the greater trochanter.
Yep.
And then it's very vast. You can see it goes way vast here, and then it comes down here and attaches over on the tibia. And but take a look at the section here. Comes down and causes lateral leg pain.
Yes.
Right here. So this section, these lower sections right here, cause it to have lateral leg pain. And a little bit, this higher section also causes it to be lateral as well. So we're going to take a look at those, and let's go. We're going to in the center section, right underneath the iliotibial band, causes pain to go way up to the hip and all the way down just below the knee, and then this gives it to you just a little bit below the greater trochanter.
And it's going to receive its innervation from the lumbar segments again.
Yes, it's going to give it to L2 and L4.
Yep, L2 to L4.
So I'm going to just take a look at L2 to L4 in this other way for a moment, just for fun. So another way to treat L2 to L4 is to go ahead and we could take a look at it this way. So you don't have to move. So you can feel the height of the hip, the hips, and you can come underneath.
Yep.
And now I'm at L4, right at the spine.
Your fingers are like this, right?
And this is the Jin Shin Do technique, where you come up and into the tissue.
Right.
And one interesting thing here is you can go ahead and you can stretch it at the same time while you're pressing on it.
Yeah.
So it's a nice way of treating it. So I can move it around a little bit and stretch it while I'm treating it. Press your knee towards me.
L2 through
And relax.
L4, exactly.
And push. And push. So I've got some taut bands I can feel right here. It's about L4. Yeah, right there. Yeah. And go ahead and press towards me and relax. And push. So you can see you're getting a little closer and closer, so it's releasing some of the taut bands right there. Yeah.
So she's getting the range of motion test to pass while she's working on that area.
So let's take a look at it on the other side. And this is, I remember when about 20 some years ago when I first learned to do this technique, I thought, how can you use this? It's so hard to get your fingers up like that, but I find that it isn't hard anymore. So
Yeah.
I find it so easy now. So so even if it seems hard at first, it might seem easy after a while.
Yeah.
Okay, again, you go like this, you go across the top of the hip, then that's L4, and you're going to go up from there. And you're going to look for L2. And right there, I find it on the side. Feel it? Yeah. So I'm just going to hold it there and relax.
And the key is that you see how her wrist is flat on the table, so she's not using less. She's letting that.
It's hardly any effort.
Yeah, hardly any effort.
But you know, it's a good technique, a really good technique, on treating the spinal roots again. So I'm feeling the spinous process, then I'm coming and pressing towards the spinous process in the middle, and then towards the transverse process. Good. Okay, so let's have you turn sideways, and we're going to take a look at this tighter one that you were talking about. So I'm going to use the body support. So just you can sit up for a second.
Sure.
And I'll put the little hot water bottle here. Go ahead and lay sideways towards the window and put your shoulder in the crevice. Tell me if you're pretty comfortable. Great. Okay, so we're going to take a look. Let's bend this one here. Okay, bend this one also. There. Okay, so I'm going to look at it a little bit while I'm stretching it. So you can see here, I'm looking at the basket.
She's got the leg pinned.
So here, I've got the 4 fingers. So we're going to go ahead. So even, after we treated the spinal root, it's much closer. So when she was laying on her back, she had about 7 inches.
That's right.
So here, so after we treated the spinal root, she came to here.
Yep.
So that was contributing to about half of the range of motion dysfunction.
Yeah, yeah.
So, hey, what do you think of that?
I like that.
So we're finding the greater throat cancer, and then we're going to come just below it right there.
Great.
And we'll start with that. But
Okay.
remember, the ones that are lower down tend to cause the pain down the into the lower leg.
Sure.
Now, a lot of times, if I have the leg here, then I can see, like, each area that I'm working on. I can see if it's causing, if I treat it and it makes the heel go closer to the seat.
That's right.
I know that area is contributing to the limitation and the range of motion.
Yeah, exactly. So she's putting it on the stretch, and if she hits a spot in the vastus lateralis, it suddenly causes the leg to release, and the more stretch that she knows that's exactly the cause of the limiting range of motion.
Right.
So she works that spot a little more.
Okay, so I'm going to come along here and come to the fastest.
Don't you guys wish they taught this in massage school like this? Wouldn't that be great? If they put somebody in this position at the table in massage school and said, this is how you treat the vastus lateralis.
Yeah, that would be good.
Yeah. I bet some schools, something like this.
Some probably do.
Some probably do. They've got lots of other things to teach.
Okay, go ahead and push towards me and relax. And what would be great if our doctors knew all this?
Well, if the doctors knew it, then we couldn't poke fun at them. So I don't think that'd be good at all. I'd lose about half my weekly entertainment. I'd have to find a new sitcom to watch. I don't know what I'd do. Can I tell them my MD joke?
Yes.
Uh-oh.
I want to hear it.
All right. Yes. All right. Yeah. All right.
For all you MDs out there, don't listen.
This is close your ears, MDs. I have an infamous problem with acronyms. You know, if you say NBC, I never remember. National something, I just can't remember. So for the longest time, when people said, oh, he's an MD, I thought that meant mentally disabled. You know, I didn't know it meant medical doctor. I thought it meant mentally disabled.
Yeah.
And it wasn't.
It's really painful. Yeah, that's painful.
The joke is.
Mentally disabled.
Yeah, the joke is that it wasn't until years later that I found out I was right. I'm just kidding.
Oh my gosh! I didn't know you were going to tell that joke.
No, I'm just kidding. I'm a doctor too, so you know, it's like we're poking fun at each other. Lawyers can tell lawyer jokes, right? Blondes can tell blonde jokes. Doctors can tell doctor jokes. All right.
Sharon, tell us a blonde joke. I'll have to find a gray-haired joke.
Oh yeah.
So this area here is pretty painful.
Yeah.
So the back part of the vastus lateralis is a little bit more like a hamstring. And so I just thought I'd put that a little bit on the stretch this way. and take a look at it there.
So you're saying which part of the vastus lateralis?
The posterior portion.
This portion of it acts like a hamstring, so
Yeah.
to stretch it, you actually have to extend the leg? Okay.
I'll give me a little less pressure.
Yeah, that's okay.
What do you call 100 blondes standing side by side? A wind tunnel. Doesn't work anymore because everybody dyes their hair. You never know what color their hair actually is anymore.
Except Obama.
And everybody's getting cross-trained now. Physical therapists have multiple, things. Everybody's getting cross-trained.
Yeah.
And we're gonna have everybody learning trigger point therapy. It's
So
gonna be part of all medicine.
it's like two and a half fingers now.
2.5 fingers now.
Okay, so go ahead and press your ankle towards me, and relax, and towards me, and relax. One finger.
One
towards
finger,
me,
right on.
and relax.
Look at that.
And push, and relax, and push. Good, and push. Okay, so we got like touch. Okay,
Yep.
good.
Amazing.
So that's good. So that's really good.
Okay, that's how you do it, guys.
That's
Treat
really
them
good.
on the stretch in a position that eventually allows them to pass the range of motion
So I'm
test.
always trying to get them to pass the range of motion.
Yeah,
test.
that's Sharon's goal.
Yeah, that's it. That's it.
Pain-free and full function.
That's it. So we want to be pain-free and full function.
Yeah.
So it's good that we get in there. So, all right. So let's have you go ahead and sit up for a minute.
And as a neurologist, as a chiropractic neurologist, my goal is to get muscles to turn on and off when they should.
Yeah.
That's
One
my
more
goal.
time. Let's have you lay on the other side.
So we're always looking at function. If you aim for function, pain usually goes away in the process.
Okay. So here you can see we're 2 hand widths away
Yes.
from the butt here.
That's,
So this one's a little tight there.
yep, pretty tight there.
Yeah. So we're going to find the greater trochanter. And we're going to press up towards its attachment. On
Up
the
toward the
greater
attachment. Yep.
On the greater trochanter. Then we're come a little bit behind like that. Not pressing very hard, but she
Are you
notices it.
kidding?
Well, she's noticing.
Wow.
Well, but it's pretty painful there, yeah.
Yeah.
So again, we're putting the muscle just a little bit on the stretch, and all of a sudden now it's only a hand and a half there.
Yeah. See, you can always think in your mind, and you can ask the patient too. So, what do you think? How much better do you think it would feel if I could get your leg all the way to your buttocks?
But the thing is I'm not pushing it. I'm just noticing that it has the range of motion right now. So I'm just going to treat it and see which thing, again, makes it have, which spot that I press on improves
Or allows it.
Allows the increase in range of motion.
Exactly.
So we're pressing in, and I'm pulling the fibers a little bit to the anterior. And come down here to the tibia and the fibula. And then let's go over here. I'm going to go a little bit posterior. And we're going to look, okay, now we're just one handful, hand width.
Yep.
So that's coming along. So here. And to get the part that causes a lot of the pain here in the lower leg, we're going to put a little bit on the stretch. This way. You can feel that. That it needs the stretch there, right?
Yeah.
So I'm putting a little bit on the stretch now. And treating this posterior, inferior vastus lateralis. I can feel some taut bands right there.
They're all tight.
Right here.
No, higher was tight.
Right there.
Yeah, right. Yeah.
So we had some great findings this class. As we're wrapping up here, the list of muscles wasn't very long, but this is a very important class. Lots and lots of people come in with this situation.
Feels a little better. Yeah. Okay, so the vastus comes like, so it comes like this and comes very far back here and forward, and then comes down here and attaches near the fibula and tibia.
Yeah.
So here, we're getting right on it.
And thank you guys for watching the YouTube videos. I am seeing the hits, so that's great. It's good to see those views.
Yeah, some people just watch us on YouTube.
Yeah, that's true.
As it turns out, I found out.
Well, YouTube is a very good technology. It's very stable. We're some of the pioneers with Periscope, so they're still working some of the bugs out. But
Yes. Okay, so here.
ooh,
we're like
three fingers.
Three
Nice.
fingers. So now we're just going to increase it a little bit by using a little resistance. So go ahead and push towards me, and then relax, and then push towards me, and relax, and push. What do you think? Good? Coming along, feels good? Good, and push. Good. So here we're ending up about the two fingers from the butt here.
All right.
Okay, so that's good. That's good. So shall we do a little strength testing to see what we think?
Of the vastus lateralis?
Yeah, for the quads.
Yeah, they're not my favorite tests, but I will do it for you. I really, they're not my favorite tests. I'll show you though.
Okay. So shall we have her lay on her back?
Yeah, just lay on her back. And I'm sorry, it needs to be plugged in at this point.
Okay, sure.
So you bring, let's see, one knee up like this.
Mm-hmm.
Nope.
So you put
the other knee up like this.
Yeah, and you're gonna put the.
This is the one I put over.
Yeah.
See why I don't like it?
Yeah.
No, it's right over like this, like this.
Yep, that's it.
That's it. And it's the other arm. You see, like this. Okay. And keep the leg at 90 degrees. Okay. You're going to push up into my hand. This is for general quads. Push up. And I'm going to push down. This would be like for the intermedius. 1, 2, 3. Good. Okay. For the vastus lateralis.
Oh, thank you.
I would turn in.
We got a heart.
And I'm going to push out, down and at an angle. Push up and out into my hand. 1, 2, 3. Okay, good. And if I wanted to do the medialis, then I would do like this, right? For review, push up and in. 1, 2. Sorry, so push again. 1, 2.
Oh, the medialis.
I don't know what's going on with that.
We'll have to fix that another day. Okay, here we're going to do the vastus lateralis again. So we're going to do the general quads first.
So here we go. General quads first, or the intermedius, right? Push
and the intermedius, right?
Yeah.
Okay.
Push up, and I'm going to push down. Okay, 1, 2, 3. Okay, then lateralis, toes in, so that you're keeping the legs straight. So push up and out, and 1, 2, 3. Good. And then here, medialis, push up and in. 1, and we're getting the same problem on both sides.
So we get
medialis. We'll get to that at some point.
We're going to do that soon.
Yeah. Okay, that comes up soon.
That's next week.
Oh, it's next week. All right. Oh, lucky you.
Can I tell everybody what's happening next week?
Okay.
So we're going to do protocol 30, 33, and 35.
Okay.
So we're going to do, next week we're going to do protocol 30, 33, and 35. So if you can download those for next week. And I just wanted to review that these are the, this is the self-care for 29 and for 32. And you can get those that we did today. And then here has all the how you can do the self-care on yourself using your hands.
Yep.
And then here's your stretch, and then here is the 29 for lateral leg pain.
Lots of good pictures.
We did the peroneus, we did the gastrocnemius, the vastus lateralis, and up here the minimus. Again, the same thing. And then here's how to do your self-care, and then how to do your stretches.
Yep.
Okay, so you download that and give it a try.
Yep. Get those at myopain.com, and they're in color. We just ran out of colored ink.
Yeah. So let's take a look at the next the next ones we're going to be doing, so you can keep it in your head. So we're going to be doing the other
side, isn't it?
33, 30, 33, and 35. So let's go ahead and look at it. So that's 30, anterior leg pain. Okay.
Anterior leg pain.
Then we're going to do also 33, which is anterior ankle pain, and then 35, which is medial ankle pain. So it'll be anterior leg pain, anterior ankle pain, and medial ankle pain.
Okay, all those guys over there. All right. Fantastic. Sharon, thank you as always.
Thank you.
All right, guys. Thank you, everyone, for what you're doing. Thank you, all models. Sharon, we'll do this. Should we sign off?
Yes,
all right,
we
sign
should.
off song.
We're all gonna stand up, stand up.
Range of motion, folks.
Okay, together. Okay, we're gonna do it.
You're welcome.
And Justin from Pain Free.
Mostly Sharon.
Who want you to remain free. We will assess and use heat.
Mostly Sharon.
Then compress and repeat.
Toes in.
When a trigger point is
Toes out.
there, we'll teach you how to do self-care.
Everyone.
Okay,
Will
you twist.
at your
Twist.
peak.
Twist.
So
Twist.
see
Other
you
leg.
back again next week.
Okay, everyone. Thank you.